Okay, let's talk about Chapter 13, Billing and Collections. Billing in healthcare is very important. Healthcare is not a free item in the US. It is a booming business. So there are billing and collection methods that have to be met and equal to all, etc. So let's jump into this chapter. Chapter outline, learning objectives are listed there for you. A few key terms with this chapter. Page 264, there's an introduction that speaks to today's healthcare setting and collecting fees and with medical office visits, ER visits, surgical patients, all sorts of things. Fee schedules, it talks about Congress, what they did back in 1993. Um, Medicare service fees are calculated based on the following factors: service intensity, time needed for the service, skills needed to perform the service, practices overhead, malpractice premiums, etc. Lots of things go into fee schedules and the agreement on what Medicaid, Medicare, or private health insurance is going to pay for. Oftentimes, a physician provider may bill for $300, but they only get $50 of that based off of these fee schedules, agreements with health insurance, et cetera, et cetera. Participating provider agreements is discussed on page 265. Credit and collections. This is a delicate topic, I guess. Um, the hospital that I work in, patients that come in for procedures, whether it's simple like colonoscopies or whether it's major like back surgeries, you have to pay your copayment up front before they even start the procedure. Some people, when that started a few years back, were just appalled, and other people accepted it perfectly well because, again, healthcare is a business in this nation. It is a contractual. You have to pay for it. It's not just a free item in this country. Okay, moving forward. Side note: some offices even make patients pay in full for certain procedures like dental work, ultrasounds, or any kind of like when somebody's pregnant, if they go to these little clinics, not clinics, what am I trying to say? Not offices. Well, I guess it is an office. Anyway, they're privately owned, privately ran, likely by nurse practitioners or PAs in the obstetrics world. You pay $300 to have an ultrasound of your baby, and it's not something you have to have a doctor's order for, or it's not covered by insurance. You just pay for it, and it might even be cheaper these days. But anyway, back to the billing and the collections. These type of things must be paid for upfront, and depending on what it is, it may need to be paid for in full upfront. Dentistry, especially. I do happen to know my sister's a dental hygienist, so I happen to know that many dental offices and maybe some plastic surgery places and other places that I just can't think of right this second who collect for billing, they charge you if you pay with a credit card, there's a 3% markup on the bill. If you pay with a check, then it's just that, what your bill is. So keep that in mind as you enter the healthcare world, either as a patient, a consumer, or as an office manager, healthcare manager one day, that is a popular practice to include the credit card transaction fee and put that on the patient's liability or responsibility. Can you imagine how much your MasterCard, Visa, credit card fee could be if you did, I'm going to say 20 surgeries a month at, the surgeries cost 100 grand. Anyway, I'm digressing. So let's go back to this chapter, page 266, pre-printed brochures. It can be these type of brochures, handouts is patient education, patient information material, guidelines about paying at the time of service, allowable time frame. By the way, best practices when you're collecting money from patients, the credit limit extended, the payment practices allowable time, whether it's 6 months, 9 months, 12 months, it needs to be the same for everybody. It needs to be equal. We do not want to extend for one and not be able to do that for 1,000 others. So just keep that in mind for accrediting and reviewing, and it's just fair. We need to be equal opportunity, equal accessibility, equal rights for all. Page 267, this discusses collecting from the patients. Verifying patient identification is mentioned on the next page. Managing accounts receivable on page 269. This is important. This is just as important as paying the medical office bills, what we would owe as from a healthcare standpoint, but being able to manage what the patients owe us, what our consumers need to pay to us. Um, Do's and don'ts for telephone calls is listed down on page 269, table 13.3. I will tell you, no matter what, privacy is the most important thing. Please keep that in mind if you're talking to someone. A rude exchange, a kind exchange, a quick exchange, someone who's taken forever on the phone, whatever you do, always keep privacy at the forefront when you're talking to these people. Especially make sure you follow your healthcare facilities policy on leaving voicemail messages. That is not something you want to just leave on a voicemail to where anybody who walks in, a neighbor, a family member, can hear what you said on that patient's voicemail. Page 270, collection policies and working with managed care. Forgiving deductibles and copayments, that is a thing from time to time. Read about that, the different types of payments. A professional courtesy, this is something that can come in many shapes and forms. It used to be where, gosh, 20 some years ago, almost 30 years ago, maybe if I was working for a surgeon, they might would take a skin tag off for me, and it was just professional courtesy, no big deal. Now today, the new laws require me to register myself as a patient with that doctor. That doctor has to document on that. That doctor has to send that skin tag off to a lab. There's a lot more that has to be done. So accurate charting is very important, even if it's a courtesy, a professional courtesy. It's got to be documented for liability to prevent ever being accused of fraud, that type of thing. Page 272, patient billing statements. Every statement looks a little different. Many healthcare facilities no longer send paper because we are in 2024 and everything, well, not everything, but many things are paid online. My chart is um, what most medical healthcare mhm, facilities use. Novant Healthcare here in North Carolina, WakeMed, and there's one more. I can't think of it, you guys. They all use the online platform called MyChart. And I said that because that's where you can find your bills. That's where you can find test results, your next appointments. You can even book an appointment using MyChart. It's very convenient to have that platform. Page 273, collecting from the patient in the office. Privacy is an important thing. If somebody can't make a payment for their copay or pay for a procedure in full, those type of things need to be arranged ahead of time. We don't want to embarrass anybody. Dismissing a patient from care due to non-payment of a bill. There's things you can do for that. Certified letter is very important. That requires a signature from the recipient to ensure that that letter did get to them. That is always an option, by the way, to dismiss, discharge, or fire a patient from a practice because of non-payment. Charging interest on medical accounts is discussed on 274. What to do if a patient's check is returned. This is so rare these days. Not many people walk around with checks. I don't even walk around with a checkbook anymore. But if a check is returned, it's actually against the law to write a check that you can't cover. So just keep that in mind. We don't want anybody going to jail for writing bad checks, but there is policy and procedure to follow if it does happen at your medical office. When a patient does not pay a bill, sending collection letters. This is all discussed on page 275. Collection agencies. This is just a popular way to have a third party or to farm out or contract out the type of collections. It does a couple of things. One, it frees up your staff to focus on what's most important for that medical care facility, healthcare facility. It also can help maintain the relationship with the patients in the community because it's not you particularly calling and collecting and I want to say harassing, but not necessarily harassing. I mean, if you owe a bill, you have to pay the bill. But we got to set up a payment plan or what have you, an allowable payment plan. But the collection agencies can do some of that work for you. Uncollected accounts, they can be written off. They can be deemed uncollectible. Read about that, page 277. Collecting from estates, that's a whole different ballgame in real life. You read about that on 278 also. Each healthcare facility is going to have their own legal team with rules and regulations to collecting from an estate. And same thing with bankruptcy, that changes things, what you're allowed to do, what you're not allowed to do. overpayments on an account, I will have to say that my dental offices they do not like to give me my money back for overpayments. Um, I have to actually chase them down myself as a consumer. I have to call and say, hey, you owe me my $15 back. And then sometimes it takes weeks. Anyway, hospitals may be the same way, but it's not as often that hospitals and doctors' offices get overpaid. But I will say in the dental world, it happens, and you really have to work to get your money back. 279, small claims court. You can read all about that. And that's it. The chapter summary is on page 281. Let me know if you have any questions.